Aid groups are reporting that more than 2,000 children have been killed in Gaza. And as the sun sets on the 19th night of the siege, more than 1 million children are facing a worsening humanitarian capacity. We're going to play you some footage now taken by a 13-year-old girl in Gaza after seeing her family home destroyed. And a warning, some viewers may find these images hard to watch.
I can't understand how we can live like this anymore. We're children. I want to live. I can't live like this anymore. I can't. They're looking for people. They're still looking for people and their stuff. Is this our house? Is this our house? No, it's not. My room's down there. It's down there. Down there. My room.
Adele Khodr is the regional director of UNICEF's office in the Middle East and North Africa. Adele, thank you so much for joining us today.
Thank you for having me.
We've seen the images and we've seen the stories coming out of Gaza where half of the population is under the age of 18. The conditions there are brutal for anyone. What's your sense of the impact this is having specifically on children and young people in Gaza?
Children usually are the ones that suffer most in any conflict situation. And the children in Gaza are being killed. Yesterday, the number of children that were reported as killed was beyond 2,000 children. That's a very large number over 18 days. A large number of children are also injured. A large number of children are maimed as well because they will have injuries that are not being treated properly in the hospitals today in Gaza because of the very limited health service. There are also children who are going to have a psychological impact on their lives for the rest of their lives. Children who have seen their parents being killed, their houses being destroyed, and all the trauma that comes with this. And of course, children do not have the same level of access to food, to water, and to health services that they used to have before all this tragic violence.
We're also seeing, Adele, reports of children who are the sole survivors, orphaned. With the situation inside Gaza right now, what's your sense of who would be looking after people? Are there relief agencies that can do that, or do they just have to find extended family or friends to look after them?
You are very right in that, and I have seen photos of many children who have been the only ones to survive, many of them who are injured and in the hospitals alone. But you know, the Gaza is a place where the extended family is something very important and part of the local culture. And we hope that these children are being looked after. But definitely there will have to be solutions for them in the long run, because the poverty levels of many of these families that are supposed to be the extended families who would take care of these children is really increasing, and was quite high even before the current conflict. And as a result, taking on additional members into their families will, of course, put some burden on them. So this is indeed one of the worries for us, and one of the areas on which eventually we will be working. But we would like to make sure that all these children are kept within the families where they are, with their uncles, with probably their grandparents, with their aunts, with somebody else from the extended family. But it is very important that they remain within a family setting.
All of that just underscores the need to get aid to the people who are in tremendous need. And as you know, the level of aid that has gotten in is not nearly enough for the demand that is inside Gaza. What is your sense if there isn't some sort of a solution to get a continuous flow of critical supplies into Gaza? What happens in the next day or so?
Well, the situation is really not good at all because the reports are that the fuel available to the hospitals is only available almost for the next 2 days. So there will be a total breakdown of all the services, especially the health services. So it is a very, very big source of concern. And of course, this will impact the health services that the wounded can get, including, of course, the injured children. So for us, it is a big source of worry. We are also worried about the issue of water, because there is only one pipeline that is working in all of Gaza. And approximately every individual has access to 1 liter of water per day. That's the average that we think. Whereas the normal is a minimum of 3 liters per day. So how can you wash yourself or whatever, do the basic hygiene for yourself, and at the same time drink if you have only 1 liter of water per day? So the risk of waterborne diseases is something else that we are really worried about. There are already cases of acute watery diarrhea, and with the current hygiene and sanitation situation, we can also look at more serious waterborne diseases that will impact the children. There will be scabies, there will be a lot of things. I mean, the shelters are overcrowded. People are living in places that are not equipped to be shelters, that do not have toilets. And where probably the level of stress among all the people is so high that, of course, there might be a little bit more of violence against children. So we are really very, very worried about the situation of children. No child should ever be in a situation like what we have today in Gaza.
I want to just focus for a second on fuel supplies, in particular to hospitals. We spoke with a doctor yesterday who is at Al-Shifa Hospital in northern Gaza, and he says when they run out of fuel, that hospital is going to become a mass grave because they won't be able to run their ventilators, their dialysis machines, and in particular, what struck me is their incubators for premature babies. What goes through your mind when you hear that and consider the refusal by Israel for security reasons, the fear that it gets diverted to Hamas, but that fuel can't get in to keep the power on at these hospitals for patients who can't move?
Well, for the babies, for sure, a large number of babies who are in the incubators are going to die because this is the lifeline for them, the incubators that are there. And when you don't have electricity to run the incubators, then, the babies will be on their own, and many of them are going to die. That's the tragic situation in which we are today. And I mean, we understand the security concerns for sure, but we also have to find a means of ensuring that the minimal life-serving operations are available for those children, and those newborns.
The Israel Defense Forces put out a statement on social media responding to the criticism of the lack of fuel going in and pointing to fuel tanks inside Gaza that are controlled by Hamas and saying there's hundreds of thousands of liters there, get Hamas to get you some fuel. Is that even a possibility as far as you know? And what's your reaction to that argument from the Israeli military?
Well, we have each one of us, each one of the agencies and UNICEF included, we have some monitoring mechanisms to ensure that the aid gets only to the people who need it. And we have some ways to track that. This is what I can say. And the fuel here is needed really for humanitarian reasons. And as you rightly said, this hospital might soon shut off and not be able to serve anymore. the people who are injured, including, of course, for us, the children, and the children who are in the incubators.
Adele Khodr, Regional Director of UNICEF's Office in the Middle East and North Africa, thank you so much for your time today.